Dear students, this is Dr. Pooja Brijesh from Inside Biology. In the last two sessions of reproductive health, we have discussed regarding the factors which are affecting the fetal life as well as the mother's life. In this particular session, we are discussing regarding infertility and its solutions. Now, across the globe, you will notice nearly 8 to 12% of couples experience infertility problems between the ages of 25 and 35. Now, what is this infertility? The fertility problems are defined as not being able to conceive after 12 months of regular sexual intercourse without any birth control methods. Thus, biologically, infertility can be defined as impaired fecundity, where the women have difficulty in getting pregnant. Now, to get pregnant, we already know a woman's body must release an egg by the process called ovulation from one of her ovaries. Insemination is done by men, which will release the sperms into the female tract, which must be able to fertilize the released female's egg in the fallopian tube. The fertilized egg should be able to move from the fallopian tube towards the uterus and finally must be able to implant itself into the wall of the uterus. Now, any of the mentioned step cannot be completed successfully in any of the cases, no pregnancy will result, and therefore a fertility problem arises. Now, both men as well as women can be the reason for infertility. Age is also associated with the fertility issues. Now, in case of men, semen analysis is performed where low sperm count, that is under 15 million per ml, low sperm motility, that is movement of sperms, and the third is abnormal morphology of the sperm, that is shape of the sperm, are assessed for the infertility reasons. In women, normal functioning of ovaries, fallopian tubes, and uterus all are required to achieve pregnancy. Now, conditions affecting any of these structures can contribute to female infertility. The first problem is anovulation, that is, no release of an egg from the ovary. The second reason is polycystic ovarian syndrome. It can also be considered as PCOS, or it is also determined as PCOD, that is polycystic ovarian disease, which is a condition that will affect women's hormonal level and making it difficult for her to conceive. And the third problem is if there is a blockage or any kind of swelling in the fallopian tube that can causes obstruction to the movement of ova, and that will inhibit the fertilization event. Now, earlier, couples did not have any option apart from adoption. But nowadays, reproductive science has made great developments and multiple methods are available where infertility can be managed. Collectively, these methods can be considered as assisted reproductive technology or techniques, which is termed as ART in short. These are the following techniques. The first one is intrauterine insemination, which is also termed as IUI. IUI is an infertility treatment that is often called as artificial insemination. In this particular process, prepared sperm, what do you mean by prepared sperm? Where the sperm is washed, first of all it is collected, washed, and all its outside membrane are removed. And that sperm is inserted into the woman's uterus at the time of ovulation through cervix region. Sometimes the woman is also treated with medicine that stimulate ovulation before IUI. For example, she may be given a low dose of ovary stimulating hormones. IUI is more commonly practiced when a man has low sperm count or decreased sperm motility, or if a man has severe erectile dysfunction. The second method is in vitro fertilization. In this particular technique, fertilization of both the female and male gametes takes place outside the body, that is in the test tube or in the petri plate. It is the most effective form of ART as it is less invasive than the other treatment options. Now here in this particular diagram you will be able to notice first the ovarian stimulation is done by hormone therapy in a woman. Then the multiple egg formation will take place in the ovary that will be collected by a particular way, and after that from men the sperm preparation has been done, then those collected washed sperms as well as the eggs are fused together for the fertilization period that you can see in the fourth section. After that, the selected fertilized egg has been selected that has undergone embryo development in certain nutritive condition, and after that those embryos will be transplanted directly into the uterus of a woman. It can also be seen in this particular diagram where the injection of the hormone is given to the particular women, which will induce the ovary to produce more and more eggs at a particular time. We need to recover those eggs. Simultaneously, we need to prepare the sperm sample. Then the fertilization has been done outside the body, that is in the petri plate, as you can see in the nutrient solution. Then the embryo formation will take place. The embryo at its blastocyst stage has been inserted into the uterus of a particular female to make the female pregnant. Now the third technique, which can be termed as intracytoplasmic sperm injection, as the name suggests, it can also be considered as ICSI. This technique is often used for the couple who are struggling with male factor infertility. With ICSI, a single sperm is injected into the mature egg, which is removed from the female in the laboratory condition. Here in this particular case, you will be able to notice an egg and its cytoplasm is labeled. The sperm, which is very motile and very healthy in nature, has been selected, and that has to be injected by the injection needle directly into the cytoplasm of the egg. The egg at that particular time has been held by a holding tool. So then it get injected into the cytoplasm of the egg using a fine needle to get fertilized. The fourth technique will be termed as zygote intrafallopian transfer, or it can also be considered as ZIFT or tubal embryo transfer. This is an old technique, so it is not at all practiced much now. In this, fertilization occurs in the laboratory and the zygotic embryo, a very young embryo, is then transferred into the fallopian tube of a female instead of the uterus, as it is a very early stage embryo. ZIFT is about 5% more successful than the GIFT technique, which is the last detailed technique, which we will see in the next slide, because ZIFT involves implantation of zygote or the fertilized egg instead of gametes. Now, in this particular diagram, you will be able to notice the fertilization has been done outside the body in the petri dish, and that fertilized egg has been transferred by the transfer tool directly into the fallopian tube of a particular female at a particular location. Now the next technique is gamete intrafallopian transfer. In this particular technique, both collected eggs as well as sperms are transferred into the woman's fallopian tube, where the fertilization occurs in vivo. In vivo is inside the women body itself. So it is an intense, invasive, laparoscopic surgical procedure to place a mixture of sperms as well as eggs directly into the fallopian tubes, and therefore it is not at all used nowadays, as it is not that successful. So in the case of couples who themselves cannot produce own eggs or sperms, in a way gametes, donor eggs or donor sperm will be utilized in this particular technique. Now, donor eggs or donor sperm are useful in the case of women or men who has a genetic disease that can pass to the baby. So we need to avoid it by having the donor egg or sperm. These days, couple have the option of donor embryo also, where the embryo are either created by couples in infertility treatment or were created from the donor sperm as well as donor's eggs outside the body, and that donated embryo is then transferred into the uterus, but the child will not be genetically related to the either of the parent. The positive impact of these kinds of reproductive technology assist many couples who would not otherwise themselves get pregnant and have the children.